Hello and welcome to the Arise interview, where we take time to reflect on the big stories from the news and on the fortunes and affairs of the world in an hour of conversation with commentators, analysts and thought leaders. I'm Charles Aniagolu. Coming up in the next 60 minutes, it's been 6 months since COVID-19 was first detected in Africa. Since then, the virus has spread across the continent, but while it's raced through many regions of the world, in Africa, many countries have been experiencing a gradual rise in cases. But there's also been a lot of progress. In Nigeria, for instance, testing has increased and diagnostic, preventive and treatment measures have been strengthened. There's even research now into a possible vaccine, thanks to companies like 54Gene, an African genomics startup. We'll speak to the CEO of 54Gene, the geneticist and research scientist, Dr. Abasi Ene Obong. And later, as the US Democratic Party formally nominates Joe Biden for president on the second evening of its virtual national convention, we'll speak to a member of Democrats abroad about how they're making the case for a new family at the White House. We'll also hear from a former Nigerian presidential candidate who's in America watching the elections campaign. What lessons are there for Nigerian politics and its electoral system? Coming up in a moment. First, to the reality of COVID-19 in Africa, and here in Nigeria, bringing the brutal truth of exponential growth to our doorsteps, the case count mounting every day, along with a rising death toll. To be fair, Nigeria still has a relatively small number of cases, and so far has been spared the worst of COVID's ravages. But health experts fear populations will, in the long run, be hard hit, which is why molecular testing is absolutely vital. And that's what the health technology company 54Gene has been doing, testing thousands of Nigerians through its NCDC accredited fully kitted laboratories in Nigeria. It has also been engaging in extensive, sophisticated research with the aim of making medicines, possibly vaccines, available in Nigeria and across Africa. Well, in a moment, we'll speak to the CEO of 54Gene, Dr. Abasi Ene Obong, who is himself a cancer biologist and immunologist. But first, here he is speaking at the inauguration of the This Day Dome COVID-19 Treatment Center in Abuja.
For the first time in a very long time, everyone in this country knows the name of a disease and is speaking that disease at the same time. And everyone is talking about antibody-based tests, antigen-based tests, PCR-based tests, things that would have never been in the lingua. This may be the opportunity for Nigeria to stop paying lip service to molecular sciences and actually start executing, and actually start investing in education, actually start investing in healthcare. We've seen how our hospitals are not well equipped, right? And so there is now a lot of attention in the healthcare sector and in the science sector, not just in Nigeria, globally. And I hope that that becomes one of the positives from COVID-19, because it made us as a country begin to build the infrastructure we need for the future.
Dr. Ene Obong there, and well, for the latest on the COVID outbreak in Nigeria and how the disease is being tackled, I'm joined now by the man himself in the studio, Dr. Abasi Ene Obong, CEO of 54Gene, one of Africa's top health technology companies. Thank you very much indeed for coming in.
Thank you, Charles.
And we can suitably say, can't we, that your company 54Gene has been at the forefront of the battle to tackle the coronavirus here in Nigeria?
Yes, we can say that. And to be honest, we've seen this as a privilege. You know, when COVID-19 first hit, when we knew it was coming to Nigeria, I called my staff. So prior to COVID-19, we have been doing molecular research around things like cancers and cardiovascular disease. And so we had built up this necessary skill set to do molecular testing. And so I called my team, my staff, and I told them that this is a watershed moment for us. If we as a company can't do anything here, then we have no right to be in Nigeria. You know, so although we see ourselves as a global company, we also have to be local. We have to look at how we contribute to the healthcare system in countries that we are in. And so it was a call to action for all of us, and we had to quickly build capacity and capabilities by setting up labs. And right now we've recruited more than 110 new staff just working on COVID-19 testing. And they're all deployed across the country. So we're happy to have been given that privilege.
And I was reading, I mean, you've tested thousands of people, haven't you?
Yes. So at the moment, our labs account for at least 10% of all tests that have happened in Nigeria.
And, well, I mean, in a perverse way, and I can't help being a little bit perverse, I mean, global tragedy has become a sort of business opportunity for you, but also a development and research opportunity for Nigeria.
Yes, and, you know, when when COVID-19 hit, for us, it wasn't so much about, you know, what we get of it. For us, it was how do we give back?
Absolutely.
And so
altruistic motive.
Yes, and so we set up PPP, you know, models with a number of states. We actually donated money ourselves to help beef up the capacity of testing in public labs. At the time of the testing of COVID-19 starting, there were only about 5 labs in Nigeria. We couldn't do more than 200 to 400 tests a day. And so my first thing was, how can we support the public labs as the first line of defense? And so we spent we raised about $500,000. We seeded that fund, and we had some other companies like Union Bank also contribute to that fund. And we used it to buy, you know, molecular equipment for public labs. And that was the first, you know, call of action we did. We helped improve the lab capacity in the country. It took it to about 1,000 tests a day. From where it was initially, and then we found other innovative ways to, you know, to fund testing. So we went into partnerships with other private companies and governments to fund testing for populations, free testing.
So your company deals more with testing and not testing and research, and not the treatment side of it.
Yes, correct.
Right. Nevertheless, at the outset of the COVID pandemic in Nigeria, most of the cases, and I'm sure you're aware of the literature around COVID in Nigeria, most of the cases were linked to imported cases, and there were virtually no reports of community transmission. What's the state of play now?
So the right way to answer that, I guess, would be that at the start of COVID, we were testing cases, right? So because as a country, we had limited resources in terms of we didn't have enough labs, you know, or people to do the tests. We had to focus on, let's test the people who have symptoms and their contacts. Right, and so when you're testing only people with symptoms and contacts, you're not really testing, you can't really talk about community transmission because you're not testing there. We are now in a place as a country where in some states, community testing has started. And, you know, and community testing basically is somebody testing who may not have a symptom. And you would notice too, if you've been following the numbers, that at the beginning we had cases at about 20% prevalence. With community testing, we are seeing that number is coming down.
Right, and are you concerned that as Nigeria has seen more imported cases? Because I mean, there's always the talk about a lot of it came in from abroad. I mean, some may be slipping under the radar, particularly as asymptomatic carriers seem to be part of the problem.
Yeah, so I think that in the majority of the world's locations or geographies, COVID happened as imported cases, right? Because it started somewhere that wasn't Nigeria. And for it to have come into Nigeria, it came in as, you know, an imported case.
Right.
And so there is a need for us to really ensure that we are having a very strong surveillance system at our airports, especially now that the airports will be opening up. Right?
That's a very good point, because my next question to you was going to be, Is it your observation? You're in touch with the NCDC, you're in touch with all the agencies and so on dealing with this, the Presidential Task Force on COVID-19. Does Nigeria have a good tracking system?
I can tell you that the agencies and authorities have been working on this issue and this problem, potential problem, trying to solve it. And they haven't arrived at the decision to open up airports lightly, right? So even before opening up airports, there was a trial run testing people who were coming back. Repatriated Nigerians, or what we call returnees, people who were stranded in other countries for most of the COVID-19 pandemic. And they have used this to also learn how to sort of mount surveillance systems at the borders. It's not an issue that we are the only ones dealing with. I think all the agencies are really working together, and that's something I've liked seeing, to make sure that together we can mount a good defense system. And so it's only because of that confidence that they have now that they're looking to open up the commercial flights. And
you, of course, an international scientist. I mean, you do research. You're a cancer scientist. You've done collaborations with major international companies, hospitals, and all that around the world. Are you impressed with what you're seeing here? I don't think that we can compare countries, because every country has unique situations, and every country in their unique situations have things that are unimpressive. Yeah, but are you struck by the fact that Nigeria has come this far and the healthcare system is still as ill-equipped as it is? I mean,
of course, that's something I've said on a number of other platforms, that it's sort of a watershed moment for us as a country, that we haven't prioritized education, which was said in the clip earlier on, and we haven't prioritized healthcare. My background is I studied genetics and biotechnology. I was one of the first people in Nigeria to do that as an undergraduate. And we didn't have any labs that I could do practical work experience in. And so I knew that if I was going to continue in that line, I had to go further my studies. I was lucky, privileged, blessed to be able to do that.
You went to school in California, did you?
Yes, I went to school in London and in California. And I was able to get that practical experience and work with, I went to a top 5 university globally and able to really get that experience. But I was one out of 10,000, right? Because, I have colleagues who went to the same university and were in my class who cannot do what we are doing now because they didn't have the same, opportunities. And, I see that for us as a country, we need to begin to prioritize, education. Why are we not funding our labs? I think that what is happening right now is just proof of why we have to do this.
Okay, I'm going to ask you to hold your thoughts. We'll come straight back to you. Very, very interesting what you're saying there. You're watching the Arise interview. Plenty more still ahead as we continue our chat with Dr. Abasi Ene Obong, CEO of Nigeria's leading health technology firm, 54Gene. Stay with us. Welcome back to the Arise interview. I'm Charles Aniagolu. Well, Nigeria is still awaiting the predicted tsunami of COVID cases. The country is nowhere near being overwhelmed yet in terms of the virus burden. But Nigeria has had its share of lockdown measures to reduce the spread, some of which have been eased as testing has increased thanks to the work being done by health technology companies like 54Gene, whose CEO Dr. Abasi Ene Obong is my guest today. But that easing of lockdown measures has raised fears that the virus could spread. So Dr. Ene Obong and his 54Gene company are not just doing testing with the modern molecular laboratories they've set up in Nigeria, they're also going a step further and engaging in top-level research with the aim of developing treatments, possibly even a vaccine, not just for COVID-19, but for a host of other ailments that afflict people in Nigeria and across Africa. Well, Dr. Abasi Ene Obong, CEO of 54Gene, is still with me in the studio. Thank you for staying with us, and let's talk some more about the key thing that you're actually doing, which is testing. Is the availability of testing kits or testing laboratories still a big issue in Nigeria?
So it is still an issue, but it is a lot better. So it's the supply and demand problem. Initially, at the beginning of the pandemic, there was a lot of demand for tests because people were sick and people were afraid. But we didn't have enough labs or trained scientists to actually do the tests. We have, as a country, worked on the laboratory aspect and also training people. And so we now have supply, right, to be able to meet some of that demand. And I might go as far as saying we might have a little bit more supply right now than the actual demand for testing. You know, I think that a lot of progress has happened. But, you know, again, if we had to compare, which I said we shouldn't, but if we had to compare, because when you think about it too, what gives other countries trust and confidence that Nigerians can visit them is the level of testing.
Absolutely.
You know, and we are nowhere near the levels that countries will trust that, you know, we are seeing the true picture.
Right, and of course, one of your laboratories is in Abuja here. Is that at the This Day Dome?
Yes.
You do the testing there.
Yes, we do.
What are you seeing there? Give us a sense of what you're seeing on a daily basis in that place.
So, you know, at the beginning, I was very, very involved in all in testing and what was happening, and a lot of that was coming to us as we're building the capacities within the company. And so we saw at the beginning of the pandemic, there was real fear. You know, people were afraid, people were falling sick, people were dying. There was an incident, for example, where I don't know if I can say this on TV, but, you know...
Well, as long as you don't use a swear word,
I'm not
go ahead and say it.
There was an incident where we were called in to test somebody, and it was going to take us 24 hours for the result to be out. Before 24 hours expired, friends and family of that person reached out to us that the person passed. You know, had died. And obviously that the person, when we checked, the person was actually had COVID, right? So there are people that have died from COVID. So COVID is not a figment of the imagination, it is real. That said, I'm not trying to also scare people, because we also see that not as many people have met their fatality as a result of COVID. So it will be interesting to understand, you know, the science behind why, you know, it's affecting us the way it's affecting us, why we're not seeing as many high fatalities, but notwithstanding, we are.
Yes, and that's a good point, because nevertheless, because compared to other countries, I mean, it's a double-edged sword, isn't it? Compared to other countries which seem to reach their exponential phase in about 4 weeks or so, I think Nigeria took a lot longer to reach that phase where things started to double, even though the numbers are still relatively small. And that seems to be the telltale sign, because the number of passengers, talking about community spread now, I mean, there's a lot of talk about it coming from abroad. The number of passengers arriving from abroad hasn't been growing exponentially, but the number of cases has.
Yeah. So, of course, there is community spread, for sure. I mean, I have dealt with a few staff, of my staff. The interesting thing is that our COVID staff haven't really fallen ill, but our non-COVID staff.
Well, thank God for that.
Thank God for
you're
that,
sitting a meter away from me.
Yeah, you know, but that's the interesting thing, right? So we of course, because we have these people doing COVID testing for others. We test them regularly, and we have been lucky that they've not been infected.
Right.
But I do have staff that are non-COVID related who got ill in their houses, and none of them traveled.
Right.
So yes, there is community spreading. We've seen people who have seen it amongst family members, amongst their neighbors. So it is somewhere in the community, and that's why we still have to keep taking the necessary precaution as we open up, the society.
Absolutely. And Australia's Prime Minister, this just emerged today, has just announced his intention to make coronavirus vaccinations mandatory for all Australians. He said it would be free for all citizens. Is that the sort of thing that you hope will happen in Nigeria?
Hope versus reality is something that may not. I don't expect it's going to happen in Nigeria, to be honest. And I don't think it's because it's Nigeria. I think that what coronavirus is doing is that it's separating. If there were any gaps between the haves and the have-nots, it's only separating that, right? And so when you go to countries that have the resources, like you have countries like the US buying vaccines, hundreds of millions of vaccines. And so there's a race now amongst the wealthy countries to make sure that there is enough vaccines for their citizens. Now, for us as Africans and, Nigeria, we need people, our country, to be able to go make those purchases. And we are not seeing that happen.
And if those purchases were made, I mean, does Nigeria have the capacity? Has it gained access to, in other words, if the trials are successful for the vaccines, has Nigeria gained access to manufacture it locally and make it widely available and possibly free for all Nigerians? So
no, we do not manufacture vaccines. Manufacturing vaccines is actually a tedious and expensive process.
Right. So it would have to be purchased, basically.
It will have to be purchased. Right. I mean, to manufacture a vaccine, you need to invest 50 to 100 million to be able to manufacture a vaccine. So it will have to be paid for. The leading vaccine makers, drug makers, have started pricing their vaccines. One of them, Moderna, has priced it at around $30 per vaccine, per dose, right. And you might have to take more than one dose. And then I know AstraZeneca is trying to make that a lot lower. I can't remember what their pricing is, right? But again, countries that have the resources and have been in this space, what they have done is they have provided incentives for the vaccine makers. So they invested in their research on the conditions that when they have vaccines, they are prioritized.
Yes. And Nigeria clearly isn't doing that.
Nigeria clearly isn't doing that.
Right.
Yeah. So there are, global agencies trying to pool together resources for what is termed developing countries. Countries are not able to do this themselves. But again, it's not going to be for 200 million Nigerians. Yeah,
that's, it's a worrying thought, isn't it? But let's see what happens when eventually it is developed. But as you said, now is the time to strike whilst the iron is hot.
Correct.
I want to say, Dr. Abasi Ene Obong, the CEO of 54 Gene, it's been brilliant talking with you. Thank you very much.
Thank you, Charles.
And you're watching the Arise interview. Plenty more still ahead, including as the US Democratic Party formally nominates Joe Biden for president at its virtual national convention. We'll speak to a member of Democrats abroad, part of the American Democratic Party. Stay with us.